On this street in Barwell, Leicestershire, live not one, but two healthcare hideaways. Janice and Greg have been together for 20 years. They suffer from very different health problems, but they have one thing in common.
I haven't had any dental treatment in approximately 15 years because I am petrified.
I haven't been to the dentist for years because I'm too scared to go.
15 years ago, Janice had an abscess removed from her gums. She was so traumatised, she never went back.
The pain was just awful, absolutely awful. I'd rather have a baby, to be frank.
And Greg was 19 when he last saw a dentist.
I felt the cut, the removal of the tooth, it was horrendous. And consequently, I've not been to the dentist for 30-odd years.
Janice and Greg are not alone. 1 in 7 adults have a crippling fear of the dentist, which can lead to serious neglect. This is obviously the case with Janice and Greg, so I was really pleased when they took a huge step and agreed to meet me.
Hello.
Hello, come on in.
Greg?
How are you?
Yes, I'm Katie. Nice to meet you.
Pleased to meet you.
Thank you.
Come
Cheers.
through.
Thanks. How bad are your teeth?
How close do you want to look?
I need to see what I'm dealing with.
I mean, that one,
Oh my God, it's just hanging there.
yeah, that's...
Oh my God, they are literally hanging there.
they're just hanging. Would you just like to come through and meet Janice?
I'd love to. Let's go, yeah. Having no teeth, or having, like you said, loose teeth or rotten teeth, is going to completely limit your diet, isn't it? I mean, what is it like for both of you diet-wise?
I mean, I can't really bite anything.
So, are you in constant pain?
A lot of pain, yeah.
Yeah, oh my goodness.
It's affected me. I've lost about 4 stone.
4 stone?
Over
Oh
the
my...
years, yeah.
That is not good.
Janice, however, is now 29 stone, due to her diet of soft, easy-to-chew food.
I eat trifle, melted cheese,
Yeah.
stuff like that.
It's so soft and easy for you to swallow, I suppose.
Yeah.
We're sort of smiling, but what is that doing to your organs? What is that doing to your life expectancy? You know, how dangerous really is all this? At any point did you think, although you're traumatised, just go back and try one more time? Did you ever try to go back to the dentist before it got to this breaking point?
I've thought about it, but it's doing it. I have heard a couple of people say, his breath stinks.
Have you heard that?
Yeah, I've heard it. You're
Why
conscious
have
of
you
it.
never told me that?
Because I don't want to.
Do you ever kiss each other?
No.
Never?
Never.
No. Can't remember the last time we kissed.
No. Really?
Yeah.
No.
And this is all because you're conscious of
Because you're conscious of it.
They both know they have to change, and bad breath is the least of their worries. Janice is in a health trap. Her dental problems have led to a poor diet, weight gain, and last year this led to kidney failure, which almost killed her. The situation is now so serious, her 20-year-old daughter Lorna has had to become her full-time carer. And there's a whole host of drugs needed to manage Janice's weight-related conditions.
Hello. How you doing?
Not too bad, thank you.
I don't know, I was kind of talking to your mum and dad, and I suppose I was kind of putting myself in your shoes. You know, I've got parents similar age to you. None of us can hide from the fact they are slowly killing themselves with the diet.
Yeah.
And the diet is because of the teeth.
Yeah.
And the teeth is because of the fear.
Yeah.
It all stems from that fear of the dentist.
I don't like the dentist, no one does. It's the smell and the noises and everything, but at the end of the day, you do need to look after your teeth, and they haven't really been brought up with that, I don't think, either, like I have.
If they carry on like this, they're not going to be around for long.
I'm not only shocked by their health, but also by the fact they're only 49 years old. Janice's weight is a serious threat to her well-being. Doctors have refused to perform gastric surgery until her health stabilises. However, they agree that fixing her teeth is a good first step as they're playing a major part in her poor diet. It's not always a fear of treatment that stops us getting help. We don't always know what's available, have the confidence to ask for it, or we're just too self-conscious to talk about it. I'm determined to help as many of Britain's medical shut-ins to get the help they need. And I'm on my way to Scotland to meet a young trainee teacher. Joanne lives with her family in East Kilbride, but unlike most 20-year-olds, she rarely goes out.
I suffer with psoriasis. It's an autoimmune disease and it affects my skin. It makes me feel different, horrible, disgusting. I'm not sure why I have it. It's just one of those things. Just one of the unlucky ones.
Her older sister Rachel is worried about how it's increasingly affecting Joanne.
She found it difficult to go out, she found it difficult to make friends, she found it difficult just to be happy.
It's really hard to leave the house some days. I don't leave the house often unless I need to.
Psoriasis causes red, flaky and dry patches of skin that can appear anywhere on the body. It affects 1.3 million of us, and hiding away is not the answer. So I was really excited that Joanne had invited me to talk through some more proactive solutions.
Hello, you must be Jo, right? I'm Katie, nice to meet you.
Nice to meet you.
Are you quite uncomfortable physically?
Yeah, I wake up and there's like blood on my sheets like every morning. My jammies are covered in blood and stuff.
Would you be comfortable to actually show me?
Yeah,
Okay. Is this the area where you're most affected on your tummy?
Yeah, and on my back as well. And then it's all like round my ears.
Yeah. And you can see it looks uncomfortable as well, like you said, because it's sore, it's dry.
Yeah,
It is a life-changing condition, isn't it?
Yeah.
Our skin is made up of 3 layers, and it's the epidermis at the top where the extra skin cells in psoriasis collect. Skin cells are normally made and replaced every 3 to 4 weeks, but in psoriasis this process only takes a few days, and the resulting buildup of skin cells is what creates the flaky, dry patches associated with psoriasis. There's no cure, but there are a variety of treatments to help manage it better.
It is quite similar in a way to burns because it's not like where you've got a condition that one day you'll be gone, just ride it out, there is a cure, be patient.
I just feel like sometimes I make people feel uncomfortable when I'm like around them with psoriasis and stuff, and I would hate that feeling.
Really? What about you? What about living for you?
Yeah.
That's sad. Because you only get one life, and if you spend it living it for other people, it would be a miserable life.
Yeah. Like I never feel like nice, and I don't know.
With, you know, burns and scars and with psoriasis, it's sort of like you're going to have it forever, so you need to find a way to accept it and live with it.
Yeah.
And I don't want to talk for you, but I'd imagine at a young age that is quite hard to accept.
Yeah, I feel like I'm at a point in my life now where that's exactly what I'm trying to do. I'm trying to find a way of dealing with it and coping with it every day that's realistic, because I can't go on like living like this.
Of the many treatments available, there's at least one Joanne hasn't tried yet. It's very rare and requires a stay in hospital. And in just a few days, she's going to try it for the first time to see if this could be her answer. There are 8 million people living with a skin disease in the UK. In fact, it's the main reason we visit our GP. And patients can be young and old. Here in Bedford, neighbours have started to see less and less of one elderly couple. And it's all down to a new feature on 80-year-old Stan's face.
He's always been the life and soul of everything, But at the moment, he doesn't like really mixing with lots of people anymore, like we used to. Oh, look what I've got. There's an Elton John tribute concert going on in the hall, which we went to last time. But this time, straight away, as soon as the tickets came up, he went, I don't want to go, Sonia. And that is because of the nose. I know it's because of the nose.
While his glass eye has never bothered him, the new addition to his nose does.
It makes me feel self-conscious and uncomfortable. It's not a very nice thing to have on the end of your nose.
For the last 2 years, Stan's watched his nose get bigger and bigger. He has a rare condition called rhinophyma, which starts when the blood vessels expand and fill with blood, making the nose red and swollen. This causes the oil glands to overproduce and the skin to become lumpy, spongy and shiny.
I feel now as though I'm an oddity. I feel that people are staring at me and thinking to themselves, oh, I'm glad I haven't got a nose like that.
It's often mistakenly linked to heavy drinking because of the redness caused by too much alcohol.
People think I'm an alcoholic maybe because of the red nose, but I only drink maybe a pint of shandy a year, like, you know, so...
It's nothing new and is seen in a painting as early as 1490. From the 1600s, doctors used to remove the growths with a knife and cauterise them with a hot poker. Today, in extreme cases, it can still be fairly unpleasant, and surgeons often use blades. Other treatments include dermabrasion, where the upper layer of the skin is removed by a rapidly rotating brush.
Right then, good luck. I hope it don't hurt.
See you later.
Fortunately for Stan, his treatment's going to be far less bloody.
We'll see you all nice and new when you come back.
Yeah, I'll see you when I come back then, eh?
Bye then. Bye.
In London, Dr. Farad Manibi has offered to see Janice and Greg.
I am petrified.
I haven't been to the dentist for years because I'm too scared to go.
Neglecting their teeth has destroyed their diets. Greg's seriously underweight and Janice morbidly obese at 29 stone.
I eat trifle, melted cheese.
Janice, that is not good.
Today, they've finally decided to face their fears. And they're terrified as Greg prepares to be treated for the first time in 30 years.
Greg's presenting us with a challenge in that he's got some teeth that are painful. The only way to actually get him out of pain is to remove the teeth and provide him with replacement teeth, which are going to be dentures in this case.
Best to just let him think.
I'm coming along to offer some moral support and make sure they don't get cold feet.
You are here. You did make it. Wow, I'm pleasantly surprised.
Hello, hello.
Hello,
Hi.
nice to
Harry.
meet you. I'm
Nice to meet
Katie.
you.
Hello.
Morning, Greg.
Morning, Farad.
How are you?
Good luck, Greg.
Thank you.
You can do it. It must have taken him a lot to just get up like that and say, yep, right, and just go
I
in.
can't wait to be able to get in the car with him and not say, would you like a mint? I know it's awful.
No, you're just being honest. And he knows his teeth are rotten. It's not in his head.
What we're doing now is giving you some of your favourite jungle juice. It is about the same as having a few glasses of your favourite bevy. What is your favourite drink?
Bitter.
Bitter. And how many glasses of bitter does it take to make you happy?
Not much these days.
If you're a nervous patient, make sure you research your dentist. Sedation or hypnosis can make a huge difference to your dental experience.
It's good stuff.
You like it? What does it feel like? How many pints of bitter does it feel like?
30, 40.
30, 40. Get rid of the biggest culprit, the one that was hurting the most. Open really wide for me.
Having been sedated, Greg's undergoing the treatment with just a local anaesthetic, Pretty impressive considering he hasn't been to the dentist for 29 years.
Thank you. And as wide as you can again.
The anaesthetic stops the nerves sending pain signals to the brain, so he'll only feel a bit of pressure and some movement.
That was a massive thing for him to do, wasn't it?
When I see them right next to me, I know.
I think Greg's been through so much pain and discomfort with these that he's actually looking forward to getting rid of these. Much better off without these than with.
It takes just 1 hour to remove all of Greg's remaining 9 teeth.
I got no teeth now.
Nope.
None at all.
Nope, all gone.
You've done really, really well. You made it very easy for us, honestly. Walk in the park.
And what's next then?
Well, we've taken something out. Let's put some back in next.
Yeah.
Yep.
He's back. Wow, walking. Gosh. Oh, brilliant.
Well done.
So,
Stay strong, because we believe in you. You can do it. Be all right.
Thanks, Katie. I believe you.
For Janice, we've got a mixture of extractions, restorative work, and denture work.
When the child was back again, I nearly I could have walked out.
Yeah, but you didn't.
I didn't. I got to stop here, get it done.
If you feel anything that's uncomfortable at all you need to do is lift your arm up and I'll stop, okay?
It's getting through the door. That's the hard bit.
Yeah, that's true.
Once you're in, you can't get out.
The first stage is removing the remnants and roots of her missing and broken teeth.
Thank you, Barry. Thank you. Incredible. Really, really well done.
If she has what I've had, I'll notice that she don't want it, but you don't remember anything.
It's now I feel it.
Yeah. You're back.
Yeah. A bit careful because it's now when I get. I don't know.
Yeah, it's overwhelming. It takes a lot of balls to say, actually, I want better for myself. And, you know, that's what you've both done. Coming out of your comfort zone today, coming here, somewhere new.
Janice and Greg have taken a bold step, but they still have a long way to go. Once Janice's mouth has healed, she'll have dentures fitted so she'll be able to eat properly, lose weight, and start the long journey back to good health. Not all of us avoid treatment because we're frightened. Knowing what the options are can be half the battle. Today, I'm heading back up to Scotland, where 20-year-old Joanne has checked in to Monklands Hospital to try a rare treatment for her psoriasis.
Hi, how are you?
I'm okay.
Good, it's good to see you.
Yeah.
How long have you been here now?
2.5 weeks.
Oh, wow, that's a long time.
Yeah, it feels that.
Yeah, has it felt like forever? That's so cool. I love that smell.
So what is this cutting-edge treatment? It's good old-fashioned coal tar, and it's been around for over 100 years. It's only available on the NHS in Scotland because it requires up to a 5-week stay in hospital, which makes it very expensive. The tar is applied to the body for up to 12 hours every day and causes the skin to shed the buildup of dead cells and slows down the growth of new ones, reducing scaling and dryness.
Are you comfortable to show me the progress? When I remember last time when I saw, oh gosh, yeah. Well, last time it was quite red.
Yeah, you can almost like see sun through it. So
Yeah, you can see it's. Do you know what's changed? The texture. It's not cracked and dry.
It's not like bumpy at all. It feels like soft.
Can I touch it? Am I allowed to touch it when I keep it?
Oh,
Oh,
it's
it's
so
exactly
strange,
like
isn't
your
it?
skin. Yeah,
it's weird.
it's just soft.
Yeah.
The biggest thing for me is you don't look sore and uncomfortable.
Creams are the first thing doctors try with psoriasis, with the option of drugs in the future. But they can affect hormone levels, so less invasive treatments are tried first. If you're thinking of looking into any treatments, check with your own doctor to make sure they're suitable for you. Psoriasis is one of 3,000 different skin disorders. Most are manageable, and some can be cured completely, yet many of us still avoid getting help. In Bedford, a once sociable Stan has stopped going out because of a growth on the end of his nose.
It's not a very nice thing to have on the end of your nose.
After 2 years of watching it get bigger and bigger, 80-year-old Stan's finally booked himself in with plastic surgeon Mr. Conroy for some incredible treatment.
The huge advantage of the carbon dioxide laser is that it has minimal bleeding. It allows the operator a lot more control over just how to shape the nose, and it's quicker. So you can see that the tissues are beginning to vaporise, but there's absolutely minimal bleeding. It literally just goes up in smoke. The carbon dioxide laser targets water found within the soft tissues of the nose and superheats this, causing vaporisation of the tissues. If you can smell anything, don't worry. You're not on fire, I assure you. On the smaller nodules, you can see these almost smoothed out instantly.
Just 40 minutes later, Stan's all done and his rhinophyma is a thing of the past.
Here we go, Stan. Can you see to do it? Mind you don't poke yourself in the eye. All right?
Yep. Go on in.
Do you want to have a peek at it?
Yes, please. Bloody hell fire.
Yeah?
Great stuff.
You happy?
Oh, super duper, yeah, I am really happy.
Excellent.
Well happy, yeah. Funny colour, isn't it?
It is a funny colour. It will look worse before it gets better because it will form a little scab on it. Yeah, I think you should get a super result. I really do.
Stan's nose will only take a few weeks to heal.
I definitely want to see the old Stan back. I do, definitely. And then we can do what we want again, then, can't we? Go out and do whatever.
Sounds like Dad.
Oh, yeah.
Here he is. Oh.
Whoa.
Oh my God, look at you.
That's brilliant. No nose is good nose. Isn't it?
Wow.
Yeah, I'll tell you what, and it never felt a thing.
Oh, excellent.
Oh, brilliant.
But much better than it was before.
And as promised, just 3 weeks later, Stan's nose is completely back to normal. And so is his social life.
Your nose looks good, Stan.
Looks all right, doesn't it, mate?
Really
Yeah.
brilliant, isn't it? Really, it's great.
Yeah. I don't mind coming up in there because don't frighten the customers.
At 80 years old, Stan is living proof that you're never too old to benefit from seeing a doctor.
Cheers to the nose. Yep,
to the nose. Thank you very much.
Cheers.
Tell you what, it's great to be out and about.
Good. Happy days.
My life's been totally transformed by medicine.
Thanks so much for your help.
So I'm horrified by the number of people living with shocking health problems, who suffer in silence rather than see a doctor, or in Janice and Greg's case, a dentist. They've been dodging the dentist for 30 years, so their teeth had practically rotted away.
They are literally hanging there.
They're just hanging.
The impact on their diet and health has been catastrophic. So it was a relief when they took their first steps back to health and saw a dentist.
It's getting through the door. That's the hard bit.
Yeah.
Greg's 9 remaining teeth had to be removed, and today he's heading back for the next stage of treatment.
You all set then, mate?
I'm going back now, is there?
It's my turn.
Yeah.
next.
Yeah.
Rather. Oh, stop it!
See you later.
You take care.
I will. See you tonight. Gearing or taxi, all right?
Yeah, okay.
All right, bye.
Bye. It is a big day for Greg, and I'm just really pleased that he's conquered that fear that he had deep within him and got this far, because I never thought he'd do it.
Greg's teeth had been completely destroyed by advanced gum disease. Known medically as periodontitis, it starts with a buildup of bacteria in the mouth. The bacteria irritates the gums, causing inflammation. Left untreated, the gums start receding away from the teeth, leaving small pockets where more bacteria builds up. In extreme cases like Greg's, the gums completely detach from the teeth. Eventually, even the bone holding the teeth in place starts to recede, making teeth wobbly. Unfortunately, Greg's gums and bones have receded so badly, his only option is dentures.
Does it cause you any discomfort when I do that?
No, not really.
That was the easy part. This is the more challenging part.
We've been creating false teeth for 2,000 years, first using animal teeth and then ivory, until the 18th century when we started using human teeth in an ivory base. The teeth were first removed from dead soldiers after the Battle of Waterloo, so the dentures became known as Waterloo teeth. In the 19th century, we reverted to porcelain, and the ivory base was replaced by vulcanite, a hardened rubber developed by the Goodyear family. These were cheaper, so dentures stopped being only for the rich. And today, 1 in 5 adults have full or partial dentures, all made from plastic. Today, Greg's having his checked for size and comfort.
Is that okay?
Hurted.
Okay. Let's take this out. Open wide for me. I'll try that again. I'll try and hold it more gently. It might have been me squeezing on it, so I'm sorry. Open really wide for me.
Unfortunately, Greg's lower jaw is too damaged to support dentures, so he's going to need to come back for implants which will hold them in place.
Bless you.
Teeth are not the only thing we can now replace. In Britain this year, 6,000 men booked in for a hair transplant, and technology has more than kept up with demand. This is Artas, a new robotic surgeon, and only one of 2 in the UK. Scott, a 41-year-old father of 2 from Liverpool, is one of only 250 men to be treated by it this year.
Hi, Scott. I am a little bit apprehensive today, to be fair. Going into this room and seeing this machine, it's absolutely massive. I am a bit wary how much it's going to hurt.
Remind me again, how old are
you? 41.
41, okay. So.
Almost 1 in 2 men experience hair loss by the time they're 35.
Touch this up a little bit.
In my 20s, when I started receding, I was devastated. I automatically felt older. I felt like I aged 10 years, and that just progressively got worse. You know, my confidence was coming down more and more the longer I was leaving, getting treatment.
We've been battling hair loss for thousands of years. Julius Caesar hid his with a laurel wreath, while Louis XIII had wigs created to cover his bald head. In the 1900s, we tried suction caps, which claimed to draw blood to the surface and stimulate hair growth. We've since tried everything from comb-overs, pills, and potions to sprays, until finally the early transplants of entire plugs of hair. Even today, hair transplants are no quick fix. Scott had his first one 2 years ago. But for the final treatment, Dr. Farjo wants to use the new robot.
It's not necessarily better than human, but it's more efficient, it doesn't get tired, it keeps going, and of course there's going to be variation from one practitioner to the other.
Scott's hair is shaved because it's easier for the robot to extract grafts when hair's short. A grid's fitted to where the grafts will be removed, and a local anaesthetic means he won't feel a thing. Each graft is a small piece of skin containing the hair follicle. A follicle is a bag-like cover which protects the roots, and each follicle can hold up to 4 hairs. The average person has around 100,000 follicles on their head, but if you're blonde, you can have as many as 150,000. In some men, hormones cause the follicles to shrink. So as the next new hair grows, it's thinner than the last, and eventually all that's left is a much smaller follicle and a thin stump of hair that doesn't grow out to the skin's surface.
The robotic arm takes pictures, about 50 pictures per second, of the hairs, analysing them, deciding which ones it wants to remove, but also it calculates the angle at which the hair is coming out and the direction the hair is pointing so that it can extract the graft whole. What I'm doing, I'm monitoring, seeing what it's doing. So the green one is the one that it's about to remove. The purple one is the one that is going to remove afterwards. So I'm keeping an eye on all that, and if there's anything that I think it's going to do next that I don't want it to do, then I could instruct it to skip.
The robot can extract 1,000 grafts an hour, almost twice the speed of a human. It leaves them on the surface of the scalp where they're collected by hand and categorised according to the number of hairs in each follicle. The robot's removed 1,350 grafts, and each one is individually implanted by hand back into his scalp. It's all taken 5 hours. Follicles don't rely on a blood supply or nerves to survive, so they can be replanted anywhere on the head.
Are you ready to have a look, Scott?
Absolutely dying to see.
Have a look.
I just can't believe it. Fantastic. Absolutely exactly what I wanted.
It looks pretty busy. We managed to pack a lot of hairs in there.
As they settle, the follicles merge with the patient's tissues. The shock of being moved causes the existing hair to break off, allowing new hair to grow in its place.
2 decades of losing my hair, being concerned. I just feel now, you know, that has just totally gone out the window. So for me, so excited.
Another patient recently went from this to this in just 12 months. So Scott won't have too long to wait before he has a full head of hair again. In central London, a previously reluctant patient is reaching the end of her treatment. Janice's rotten teeth led to a diet of easy-to-chew soft and fatty foods, causing weight gain and a variety of medical problems. Today, her journey back to health begins with a new set of teeth.
Right, let's have a look. Now, the next bit we're going to try and do is put your tongue to the back of your palate and back together. Good. That's where they go. And I couldn't have wished for them to come together any better than that.
Oh dear, wow.
Hello, me.
Oh. I look so different, don't I?
Yeah, it is.
Are they big enough for you? You said you wanted to have quite big teeth. Do you think they look big enough?
Yeah.
Should we get Greg and Lorna in and see what they say? Right. Come on in. Well, Janice wanted to show you her new teeth, so it's all yours, Janice. Take it away.
Wow! You look amazing.
Do I?
World's your oyster. Off we go, upwards and onwards. Very good.
It's been more than 15 years since Janice has had a full set of teeth, and I'm astonished at how quickly they make a difference to how she looks and feels.
It feels strange at the moment. It's bound to feel strange, but I'm trusting my loved ones that they look nice and they feel nice, they feel great. I just can't believe that I've actually got teeth.
Janice isn't the only healthcare hideaway who's discovered the benefits of treatment. 4 months ago, I met 20-year-old Joanne.
Hello.
In East Kilbride, Scotland. Her skin condition called psoriasis made her feel so self-conscious she rarely left the house.
I'm trying to find a way of dealing with it and coping with it every day that's realistic, because I can't go on living like this.
After our meeting, Joanne agreed to check into hospital for a month of treatment.
Can I touch it? Am I allowed to touch it when I keep it?
Oh,
it's exactly like your skin. Yeah,
it's weird.
It's just soft.
Yeah.
Joanne's continued to improve, and tonight I'm meeting her before she heads out on the town with her sister Rachel and best friend Bari. And to start the evening, a super hypoallergenic makeup session.
Hello.
Hi.
Good to see you both.
You too.
So, have you got any expectations for what she's going to look like?
And I don't think she's going to show that much skin because she never has. But
Yeah.
I think just a smile will just say
I
it
think
like
that'll say it all.
1,000 words.
Oh my God.
You smell nice too.
I love you.
Oh, you too.
Are we
I
born?
didn't think she was going to be wearing that. I so expected you to be covered.
Don't cry.
I think what I really love is like your arms are out on display and you like your body language is like you're at ease.
Normally I'd be like covering my arms and stuff, but I don't feel like I need to.
Until now, she's never bared her arms or legs in public. But the treatment significantly reduced her symptoms and has completely transformed her outlook.
I'm capable of so much more than what I ever thought.
Yeah, you are. So much more. You're beautiful inside and out.
Joanne looks like a completely different woman from the last time I saw her. It's not necessarily the hair and makeup thing, it's about being a bit more sure of herself and what she has to offer the world. She's just more assertive, there's a bit more bounce about her, there's this zest for life to go out there and really grab it with both hands.
I absolutely feel more confident without a doubt.
Cheers!
Back in Barwell, Leicestershire, before Greg can reach the end of his treatment, there's some tragic news about Janice.
Took her a cup of tea up, see you tonight, and
she just passed away in her sleep.
Janice's weight had forced her heart to work so hard, it simply wore out and stopped. 2 weeks later, I went to see Greg and Lorna.
How have you been coping with it all?
It's not easy. I wouldn't ever wish it on anybody. It is very difficult.
well, just a massive shock, wasn't it?
Yeah.
Post-mortem revealed that Janice had died from obesity cardiomyopathy. Her weight had forced her heart to work so hard, it simply wore out and stopped. Two months later, Greg's taken the brave decision to finish his treatment.
Janice has kept me going through this, and she's not here, but I know she's here somewhere watching. And she's made me, that's given me the courage to go on, to carry on with everything, to get it all finished. Because if it hadn't been for her, I wouldn't have been here now. You know, I'll start roaring again in a minute.
Hello there, Greg.
Hiya,
Come on in.
Thank you.
It's nice to see you again.
And you?
How have you been, Greg?
All right, as things can be, as I say.
I'm really sorry.
I
I
know.
heard about
I know.
Janice. That was terrible. It must be so hard for you.
It is very hard at the minute, but I'm going to have a smile back, so that's one good thing.
3 months ago, Greg had all his rotten teeth removed. Today, he's getting his new dentures fitted.
Gummy's my new nickname at the minute.
Hopefully giving him a smile that hasn't been seen for 30 years. I've arranged to take him and Lorna out for a meal.
I think it would be nice for him to be able to sit in a restaurant with people looking over as well,
True.
and him not feeling uncomfortable.
Yeah. How long is it since you've seen your dad with teeth?
I've never seen him with like a nice, decent, full set of teeth.
So you can't even put years on it?
No,
It's literally
so,
never,
like,
ever?
I've seen pictures of him.
Yeah,
No,
oh
I've
my
never
goodness.
actually seen him with a full set like that, no.
Sorry, recognise you.
You look absolutely amazing. Well done, mate.
You look wonderful.
Thank you. All right.
Look at you with your full smile.
Hello.
Do you feel any different?
Yeah, got a mouthful.
Yeah. Look at when you smile. Smile again. It's like a different person.
I can't actually get over it because you look fantastic.
Greg had lost 4 stone because his rotten teeth meant he couldn't eat. So today is his first proper meal in years.
This is yum. Today it's changed me. It's going to change my life.
I've never seen him with a full set of teeth like that, and them so pearly white, and them so perfect, and him beaming. To Dad, and finishing his treatment.
Janice.
To Janice.
To Janice.